Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss journeys, experiences, and knowledge from successful medical practitioners. And here we have Dr. Gaurav Muktesh with us. He is presently a consultant in the Gastroenterology department in PGIMR, Chandigarh. And he's here to discuss about his interesting journey of selecting this branch. How did he do that? What were the interesting events in his journey, and everything about it? Welcome, Dr. Gaurav, to the platform. It's really nice to have you here and discussing such an interesting topic today.
Thank you, Dr. Ayushi. It is a pleasure.
Yes. So let's quickly start with your journey. How did it start all over? What were the interesting events around it?
Yeah, well, I started off with my MBBS career back in 2004. I started my MBBS. That was in Aurangabad at Maharashtra University of Health Sciences. Subsequently, after finishing my MBBS, I prepared for my MD entrances. I secured good ranks and I got into MD medicine at University College of Medical Sciences at Delhi University. After my 3 years of MD, I realized that gastroenterology was my calling. I was an intervention guy, and I started preparing for my DM entrances. Within 6 months, I got into my DM program of gastroenterology at PGI Chandigarh, and it's almost been more than 6 years now at PGI Chandigarh. I did my DM. Then I was a pool officer, which is senior to a resident and junior to a faculty. And then now, for more than a year now, I have been a faculty working at PGI Chandigarh.
That's really nice to know, and great to understand about the whole journey. So what I know, there has been some really interesting events with you selecting your branch for your MD. How did it happen? Just what is so interesting about it?
Yeah, so I think I'll begin with how I started. When I was preparing initially, uh, we initially did not have much idea about how to prepare for MD entrances, what exactly is the study material, how many hours you really need to be studying, and I got some vague ranks in all India, somewhere around say 3,000 or something, and my parents were very inclined that you next year you might not get what you're getting right now. I mean, this is back in 2010 is what I'm talking about. So you take whatever you're getting. I mean, life doesn't give you second chances. So I said that, if I compromise now, I'll be compromising all my life. So give me some time, I'll prepare. And when I have beliefs in myself, I will end up getting what I really wanted to do. So I dropped 1 year. I sat down and I prepared. And thankfully, by God's grace, I got wonderful ranks. I had around 70 rank in all India. And then I got into AIMS. I got into several other entrances pan-India. And a rank like 70 is not something that you expect. I mean, you don't see it coming. You prepare and it suddenly happens. And because of peer pressure, and my parents are doctors, so they suggested, don't risk another entrance. And you have already given 1 year, take up radiology. It is the best thing that can happen to anybody. And before you realize, you're actually sitting at the conference venue, and you have to make that call. And because of peer pressure, parental pressure, whatever you may call it, I ended up taking radiology. And I think that was, thankfully I came out of it, but I could not sleep for 3 days. And my mom was like, this is the best thing that can happen to any physician, any doctor for that matter. You are getting the best specialty amongst the best colleges, and your life is set and sorted. I mean, why do you want to meddle with it? Yes. But I said, this is not what I am there for. My life is different. My calling is different. My perspectives towards life are different. And I don't think I want to do radiology. So she said, so now what? In our time, we did not have these online counselings. You have to go manually take a seat.
Yes.
Once I have taken that seat, everybody ahead of me has already got their seats. So if a rank who's 71 leaves a seat, it goes to 72. It doesn't come to me. So by default, a seat would not come to me if it goes vacant, right? Yes. So that seat actually came to me. I mean, I was surprised that, thankfully somebody left medicine and that medicine came to me trickling down. And I was so happy. And everybody in the counseling venue was like, are you sure you want to leave radiology for medicine? And I said, yeah, this is what my calling is. So I think that was a big mistake that I did. Thankfully, I came out of it. And here I am in front of you doing gastroenterology, what I like.
Yes, that's a great decision, and a difficult decision, I believe, at that point in time to take. So what do you think now when people are going for their masters, understanding about the topic of picking a branch? What do you think? The ranks that a person get, how important it is in general, or should you just go by your dreams, what you have? What is your idea behind
See, I learned it the hard way. And I think I would like to tell all my junior colleagues, people who are preparing, who are into MBBS, you should dream what you really want to do. And that calling comes from within. It is not something that should be driven by peer pressure. It is
it?
not something that should be driven by your monetary gains. It is not something that should be driven by anything else. First and foremost is what kind of person you are. Are you a surgical guy? Are you a medicinal guy?
Hmm.
Are you going to be happy working in a paraclinical field where you have no direct interaction with patients? Some of the people are very happy living that life. I mean, we don't want to be dealing with patients every day. We
Hmm.
want to be sitting in our chambers, do a white collar job and come back. And then there are people who say that, we are going to be super frustrated if you don't have a stethoscope around our necks. So
Yes.
you have to understand the kind of person you are and never be driven by ranks. Money and success will follow no matter what. If you're good in your field, money and success will follow.
Okay, that's a big, that's a big point to mention. This is something that needs to be taken care of. So now, while picking up a branch, what should a person focus on, a branch or a college? Is it that a person can pick up a not a good branch in a good college? What is your idea behind
So, yeah, I'll just like to give a context here. So, as I told you, you don't see the ranks coming. When I got ranks and I got aims in other colleges, my my parents said, okay, I mean, surgery is a great field, or whatever you're getting is a great field.
that?
But that is not what my calling was. I think even if I would have become a surgeon, I would have been a terrible surgeon because I'm not a surgeon at heart. So your college is going to stay with you for 2 years, 3 years,
Okay.
maybe 4 years. If you're doing a senior residency, 6 years. But you
Hmm.
have to understand that 6 years is not life.
Hmm.
Life is huge.
Hmm.
You have to uh, live with the branch. Your branch is like your wife. So, so there is no going back on that. So
Hmm.
always go by the branch, never the college. College is secondary,
Okay.
irrespective.
That's great. So, just before our interview, we were discussing to dream about a branch, before getting into, before giving examinations, or before planning for examinations. So, if you can discuss that again, this is really interesting.
So I think everybody who is into that boat and is actually preparing for entrances must have seen that it is when you are preparing for a branch. There's this book called The Secret, and then there's a movie on it, and everybody says that
Hmm.
if you dream of something, you make it happen. If you don't dream of it, it never happens. मैं बोलूं मेरे को मैं मेरी ड्रीम ब्रांच डर्मेटोलॉजी है. आई विल वर्क डे एंड नाइट फॉर इट. इट विल हैपन. बट इफ आई से यार रैंक आने दे, जो मिलेगा ले लूंगी या ले लूंगा, वो कभी नहीं होगा. दैट विल नेवर हैपन. सो यू हैव टू ड्रीम, यू हैव टू बिलीव, and not just sleep over a dream. Then your efforts and vigor come into play. If
Hmm.
you want something badly, your energy will flow towards it.
Correct. Correct. That's very,
Always dream. Yes,
yes.
dream, believe, and make it happen.
Yes, that's very true, very true. And to dream about this is so realistic. I really like this idea of yours. So now, what are how should we decide a branch about with the career highs and lows? What are the things that you think are important to deciding a branch?
I think when you are deciding a branch, one of the basic concepts that you have to understand is that, am I a clinical guy or I am a non-clinical guy?
Okay.
Am I happy working in paraclinics where I have no patient interaction,
Hmm.
be it radiology, be it pathology, be it pharmacology, be it anatomy, physiology, whatever? So, what is the future and life that I'm looking at, and what is the personality in person? What am I? That is the first thing.
Hmm.
Once you have that calling, that okay, fine, I am a physician at heart or I'm a surgeon at heart, then you take a calling, am I a medicinal guy or am I a surgical guy? So if
Okay.
you talk to my surgical friends, my surgical colleagues,
Hmm.
they will say, we can't sleep at night if there is no blood in our gloves. For us to go inside and operate is like a passion. I mean, we can't do without it. And on the other hand, if you ask a medicinal guy or a physician, maybe a cardiologist, gastroenterologist, neurologist, anybody, they would say, we want to be thinking, is this a possibility? Is this a possibility? If not this, then why this? Why this above this? So questions, counter questions. If you have that I would say strong itch to read. I mean, I would say that, yeah, definitely physicians read more. I might be biased there, but and at the same time come to differentials, get to a diagnosis, work around that. Then you are mainly a physician at heart. So once you are clear on these things, am I a physician or a surgeon? Then you can diversify. Anytime you can diversify and choose that, this is what I want to do.
Okay. So understanding, when you just mentioned about medicinal branches, there are surgical branches and there are paraclinical branches. What are the kind of, let's discuss about the mindset, the lifestyle that is driven in each one of them. When it comes to a medicinal branch, you have also picked a medicinal branch. What is the kind of mindset that, obviously I've mentioned, a bit about it, still something in deep, what is the kind of lifestyle that a person has in a medicinal branch? Yes, please.
Yeah, sorry.
No, please continue. And what is the quality of life also in the if you pick up a medicinal branch, if you can give an insight on that?
Yeah. So if you're talking about general medicine or general surgery, life, if you're talking about in a metropolitan, is definitely demanding.
Correct.
When we were doing our medicine, we had nights, and that would follow if I continued being a physician all my life. If somebody has a heart attack, I might have to go. If I'm a cardiologist, somebody has a stroke and I'm not around, there is a golden window for that. You cannot leave an acute stroke less than 3 hours, less than 4.5 as it is. So they both are physically demanding. Surgery, definitely you have to be, physically and mentally tough. And you have to have it in mind that I am okay if I'm operating 4 hours. My friends would be awake till 2 o'clock studying, doing their thesis, and 6 o'clock they would be OT again, alert. And me as a physician probably would not be able to do that. So the perspective, and the second thing is, surgeons are very radical thinking people, I would say. Oh, there's a problem with the gallbladder, out it comes. There's a gangrene, take it out. So they would shoot, they would take out a problem, they'll come out. But physicians are the ones who thinking, oh, can it be this? If not this, can it be this? If I keep this higher, what are the possibilities? And life also, I would say, is probably less strenuous than a surgeon in terms of stress levels, because they are dealing with, cut open abdomens and bodies. But in terms of number of hours you have to put in, I don't think there's going to be any difference.
Yes, definitely.
But the problem with surgery, I think in metropolitans is, I'm talking about general surgery, the number of years you take to settle down is more. So the incubation period, because if I have to get, a surgery myself, I would think 10 times before going to a surgeon. I'd inquire from 10 people. But if I have common cold, I might, walk to the next door physician. So the incubation period is more. But if you settle down and you make it large, then, world is your oyster.
Definitely. So what is the difference between government and private for the same, and also the expectations regarding the expectations, because there are a lot of expectations when it comes to patients also, as well as during your practice also, from a surgeon and a medicinal branch person. What is the difference between the two, and how does it affect your lifestyle?
See, if you're talking about lifestyle in government and private, be it with any specialty, and I'll begin with that, it's completely different, and your perspectives and your outlooks are very different. So when you are a physician or you are a surgeon in a government center, your motive is not profit maximization or money. To be precise, money is not what you aim at. Your aim is, you need to work hard.
Correct.
You need to publish, because academic pressure is high in especially tertiary care academic institutes.
Correct.
You are going to be doing a lot of quality work, which you might never ever see even in your private practice. Right. So quality of work is indeed very good, and that is gratifying. So if you are working in a government center and you're doing something which is probably not done across the country, it is something that will, I would say it would give you a kick, just like, so many other things to a lot of people. But again, if you think that, you will earn 10 lakhs a month, 20 lakhs a month, that is not happening. You're going to get a meager salary, which is good for your sustenance and a good family lifestyle, but it would not be great. So your pleasures are academic rather than monetary. In private, yes, the work stress is more. The number of working hours obviously are definitely more. I'm not talking about government setups, especially the tertiary care academic centers where we are working probably as much or maybe even more. I'm talking about in general government and private centers. And in private, definitely pressure, especially if you're working from corporates for money, is there. And that pressure runs in your mind. Secondly, the pressure of patients is significant. I mean, the pressure to actually build up the practice, to have your own patients, to run a center. If some complications happen, you're answerable for that. That is huge. That is huge. So those things play in your mind when you're working in a private center. So when you're in a surgical field, that plays on your mind even more, because surgical complications can land up in legal suits, which is actually problematic.
Definitely. That's so true. So now, what also wanted to understand, one thing from you. You have in this discussion, you previously mentioned that a person should go with the dream branch that they always wished for. You dropped out for an year before picking up the branch, right? And we have discussed everything about the branches and the lifestyle around it. If somebody picks up a surgical, wants to become a surgeon and is not being able to clear that in a year, also drops down and does not get a rank for the same, what do you suggest for a person of that kind? What should that person do? How should that person go through around the whole scene?
So I'll tell you something. I have colleagues who are 3 years younger to me. I have colleagues who are 8 years senior to me, and we're probably all traveling the same boat. So eventually, if you look back and you see, it does not make a difference. What makes a difference is what you are actually doing in your life. Are you happy doing it? Are you satisfied with it? Are you content in life? Those things are more important than probably a year or 2 year or 3 year. At that point of time, I understand it is very, very difficult, because I have been through it, and sitting in one place and studying for a year together is not an easy job. But and at that time you're cursing yourself, यार मैं अपना time waste कर रहा हूँ, इतना time हो गया, मेरे दोस्तों को तो MD मिल गई या MDS मिल गई या DM मिल गई. But it does not matter. Trust me, it does not matter. And when you're going to be at my place, you'll say that, what I eventually do in life is what matters and nothing else. So don't think about those 1 years. Don't think about the fact that I already एक साल drop कर दिया, can I wait a year more? If you have belief in yourself and you're ready to back your abilities, go for it. Go for your dream branch, and it is bound to happen.
That's really motivating.
And same goes for MD and DNB also. A lot of people are confused. मेरे को MD नहीं मिल रही, मेरे को DNB मिल रही है, या मेरे को DNB नहीं मिल रही, मेरे को DMRD मिल रही है for radiology. Whatever. If you are in your dream branch, you'll be happy. Don't chase degrees. Chase passions.
That's true. That's true. So now, when you mentioned about this, and you have also done your DM in after medicine, what are the other, if you can just give an insight, what are the other branches, that a person in medicine can go for DM in, and just an insight on the same?
Yeah. So DM is basically Doctorate of Medicine, a subspecialty of surgeries, MCH. You all must be knowing that. In DM, you have multiple specialties. Start from brain, that is the neurology. You come to heart, that is cardiology. You go to joints, that is rheumatology. You have kidney, that is nephrology. Then you have gastroenterology, and so on and so forth. Yeah. So when you actually deciding upon one of these, neurologies are basically a lot about, these are my personal takes, I would say, I might be biased towards gastroenterology, but amongst these specialties, cardiology and gastroenterology are two interventional branches. So if an intervention guy and you don't want to cut out an abdomen, then cardiology and gastroenterology are two branches which offer you plethora of options where you can actually go inside the body and intervene and make things happen by your skill or your procedural aspects or whatever.
Correct.
Cardiology involves a lot of night stress as well, because angiographies, angioplasties happen 24/7. Right? So cardiology is something that is demanding in those terms. If you're talking about neurology involves a lot of differentials and a lot of thinking and a lot of history taking, as I said. So a lot of your history and would probably land you into a plethora of diagnosis. You would investigate and you'd probably land up with another set of diagnosis. So it involves a lot of thinking, a lot of brain stimulation, So that is what neurology is all about. But I personally think, I'm sure that neurologists would argue against it, that, certain set of diseases in neurology, just like any other specialty, might be less liable to be regressed completely. So if somebody has a stroke and you're out of window period, then you probably cannot be thrombolyzed. So the prognosis might be very poor. Cord injuries, I'm not talking about transverse myelitis that presents early. Long term, the outcome may be poorer. So in terms of satisfaction of patient improving and going home, relatively might be more in interventional fields. You take out a stone, patient is fine, goes home. You open a blocked artery, patient is fine, goes home. But neurology, that might not be true. Rheumatology, on the other hand, is a very interesting branch. It involves joints, and very few specialists are available in the country right now. Actually, the thing is that with rheumatology and orthopedics, there's a lot of overlap. So a lot of orthopedicians end up seeing rheumatological disorders and, vice versa. So a lot of education needs to go out to the society that rheumatology is a subspecialty of medicine and it is not the same as orthopedics. And hematology, again, is a very interesting branch. People, they read a lot. They have a lot of differentials in mind. But I would say that hematology is not really a branch which you can go out and practice in private, if at all you're thinking about that. Because how many lymphomas or leukemias would walk up to you as a standalone practitioner? So their attachment is usually with big centers. You can go to big corporate centers where you have a multidisciplinary team. So your aspects in probably private would go down being a hematologist. That way, just like hepatology also. You need to be working at a center where you have liver transplantation. Yes. Otherwise, working as a standalone practitioner is not a great idea with these branches. This is just a gist of what it is.
Yes. No. I can completely understand. The branches are so deep that while discussing, we cannot go deep in each one of them.
And I think people who are actually planning, I'm talking about people who are physicians or surgeons who are planning to become something or take up a specialty. Before you take it up, take some time to go and work in those areas. It would not happen overnight. Give yourself some time, some 2 months, 3 months, whatever you can. Get a gist of what it is. And then you ask yourself these questions. I am not a neurologist. Maybe a neurologist can tell you better. So you go to a neurologist who is 10 years senior to you, 20 years senior to you, and ask him what is the lifestyle for him. How does he see life from his perspective after being passionate about neurology 20 years? So don't go to your immediate seniors. Go to somebody who is into the field, working in that area for years together, and they will give you a better idea about what the field is. Go and work in that area and then make an informed choice. Don't just be rash and take by the peer pressure.
Correct.
Or monetary gains.
That's true. Some more points, if you can, if you can mention, because I know you have some really good points that you will like to mention for the students who are in that journey of deciding their branches. Like you just mentioned, that to ask people who are pretty senior to you. What else do you think that is very important for doctors to understand while setting up their career or picking up a branch?
See, I told you, the first and the foremost is you have to decide what is your calling. Once you are sure that, this is what my calling is, this is what I want to be, this is what I can be, this is what I cannot be. Then second important thing is you go and work, as I said, work in those areas. Thinking is one thing, going and working in those areas and actually feeling the specialty is another thing. Third is experiences. Just because let's say, for example, I love reading orthopedics. Correct. Does not necessarily mean that, I am an orthopedician at heart. So there are a lot of struggles of orthopedicians which I might not know. So you go and talk to people, not somebody who is your immediate senior. That's what I said. Go and ask people who are working in your area at the place where you would want to practice. If you are interested in academics, go to somebody who is working in a good center where you would want to see yourself another 10 years and you talk to him. And then after that, what comes is you make a priority list yourself. How important is money for me? Money, very important. Definitely not academic, definitely not a government setup. How important is, doing quality work and making a difference in the way your specialty is practiced? How important is research? How important is recognition? That is important. maybe academics, maybe research, maybe government centers. How important is work-life balance for me?
Hmm.
Very, very important. I cannot compromise. I have to be back in time. Then definitely private is not the place for you. Private, especially you're working in metropolitan, and if you're interested in corporates, they would squeeze the hell out of you. You got to work very hard. So these are a priority which you have to make out, and then you life is not a bed of roses. You have to make your priorities. And once you're sure, okay, fine, I am this kind of a person, I'm ready for this kind of a lifestyle, then you can probably go ahead. This is where I see myself.
Hmm. That's that. All these points are very important, and also I wanted to mention one. During our call, you mentioned one point is that you need to very much understand that you need to go for expertise in the initial years than for money is something which is very important. And with the coming generation, it's getting a bit difficult for everyone. So if you can give an insight yourself on that, I just would.
Shape,
Yes.
Shaping your career is I would say completely different area. Once you
Hmm.
have made your choices about what you want in life, what are your priorities,
Hmm.
then comes how do you shape your career and where do you take it and how do you take it.
Correct.
So as far as making priorities are concerned, I think it's very important that uh, as you rightly said, money is something that follows.
Hmm.
वो थ्री इडियट्स का एक डायलॉग था.
Hmm.
you know Success तो झक मरा के पीछे आएगी. you know if you run after money and glory, it will not come to you. If you
Hmm.
run after excellence, money and glory would follow you.
Hmm.
So initial years, I would definitely say that money is not important. It will come
Hmm.
when it is destined to come.
Hmm.
And money is not all that makes you happy. If you are
Hmm.
after excellence, if you're after quality of life, quality of work, if you are after trying to make a difference in people's life, if you are kind hearted, good at heart, money and success will follow.
Correct.
So I have seen people who've tried to run after money uh, without actually investing in their areas, and they have, they're probably felt in the retrospect that probably investing more in excellence than money to begin with would have been more prudent.
Okay. Okay, that's nice to know. So now you, after your whole journey, now you're working in a tertiary care institute as an academic faculty. How is your lifestyle and how is your experience in that, in a tertiary care institute as in academics?
So I would say that I am blessed to be here where I am. I mean, it is not something that I could dream of 10 years back that I'll be a faculty here. And PGI has been like a second home to me. It is my alma mater. I did my DM from here and I have been here for quite some time. Uh, Life has changed. I mean, when we were a resident कहते हैं कि resident is working more than somebody who's a security guard working 24/7 because
That's
you're working more than 24/7.
yes.
So residency life was definitely difficult. It was demanding.
Hmm.
As you graduate into a faculty and you understand that your responsibility grows, maybe you're not physically involved as much as your resident is, but
Hmm.
you are supposed to have more onus of what is happening, what procedures are happening, what is, you are answerable to a lot of things.
Hmm.
And then as a faculty, the pressure to uh, not just do well yourself but to guide and mentor your juniors increases.
Hmm.
So that is, I would say, interesting.
Hmm.
uh, you stay young all your life, you there with younger people who coming, they're doing thesis with you. A
Hmm.
lot of people come and they join you, and then you see they shaping their own careers. So
Correct.
that is a very beautiful aspect of it.
Hmm.
Academic pressure, publication pressure, if you're working in centers of national excellence, that is bound to be there, and that is very much expected out of you and you cannot get out of it.
Hmm.
But you are here specifically for that. As
Correct.
far as work is concerned, I think I am doing a lot of things which I am blessed to be doing because I am working at PGI.
Hmm.
So that is another joy which only a tertiary care academic center can give you. So
Hmm.
publications is good, quality of work is excellent. I would say the energy and you remaining young is definitely there because you're working with people, you're mentoring people, and then you're working in a team.
Yes.
So when you're working in a team, that in itself is, I mean, me sitting in my own clinic in isolation at one place earning lakhs and crores of money would not probably give me joy.
Correct.
So these are certain beautiful aspects of of being an academic center. The flip side, I would say, is that I again told you, if money is what you want to get, then academic and government centers are not what you are thinking of.
Correct.
You are not in a government center to get a sarkari naukri and make money. You have to understand that. If you want to do that, you can do that. But if you are not dreaming, if you're not believing, if you're not making things happen, then you are going to be one among so many.
Correct. Correct. That's a good insight on a tertiary care. How about the work pressure in this? As said, government mein thoda low hota hai. What about the tertiary care institutes?
See, government mein low hota hai, I wouldn't completely agree to that,
In
because
low in the sense it's a 9 to 5 job. It's not a obviously calls hoti hai, but after a stage, after you become senior, things are pretty okay
yeah.
on your side. Obviously, when you are juniors, things are heavy. Yes, sorry.
Yeah, yeah. Please. I understand.
Yeah, I wanted to understand your point of view on that.
Yeah. So, see, I wouldn't, comment on at the level of maybe small centers, small government centers, at smaller centers where people are working 9 to 4, 9 to 5.
Yes.
At AIMS and PGI, and I can vouch for other central institutes, CMC, JIPMR, so many more. Faculty is working very hard. And you can go probably check out the offices and see the way they are working. We come back at 6 o'clock, 7 o'clock, then we probably have a quick meal, then we are spending some time with the family, or back with writing papers, making schedules and rosters, and correcting people's your theses and research work. And add occasionally, then you have to if there is an emergency or some important cases there, you might have to be there. So in central institutes and the centers of academic and excellence, I don't think the work is less. The work is pretty much as much. The only thing is that I would say the liability for procedures in private is more. The stress to generate money is more, which is something that we are exempt of, because we are not here for money.
Correct.
If we were interested in money, we would have probably been in private centers. So that way life is good. And yes, as I told you, money is not what interests you to begin with. Your excellence does. So that is the reason why we are here.
Definitely. So now, let's end this on high note. Wanted to understand some motivational quotes or something that has always motivated you in your journey, especially during the time when you dropped out for an year. What motivated you for that 1 year to sit and study continuously and, keep yourself positive?
When I was reading, and I was told by some of my seniors that when you are not performing, or when you meet failure, or when you don't get the desired results what you expect out of life, you're upset and you're depressed. You're depressed, you tend to underperform. And when you underperform, by default your confidence, your morale goes down further, and you further go on underperforming. So this is what we something read, and I think psychiatrists would tell you better. It's known as the Beck cycle of depression. Right? This is how it's a vicious circle which takes you down. Correct. So the aim of the therapist and the physician and the patient is to break that cycle. Break it somewhere. Make believe. You start believing, you will perform. The moment you take efforts, you perform, by default results will happen. Maybe a minor change, maybe not maybe a major change, but that will give you belief. And once you have belief, it is an upward spiral from there. You've broken that cycle. So what happens is, when you don't get ranks and you don't get what you expect, you don't let that break you down. Take that as a motivation. You understand that I have to break the cycle right here and convert into being a believer rather than being a nihilistic person. So there were so many beautiful quotes that we used to keep reading and listen to, those border songs and Lakshya songs when we were preparing. So and that kept you going all the time. But I think if I have to pick up one, there were these famous lines which say that, you know, खुद ही को कर बुलंद इतना, खुद ही को कर बुलंद इतना कि खुद तकदीर लिखने से पहले खुदा बंदे से पूछे कि बोल बोल तेरी रजा क्या है. So I'd like to end on that note, and this is specifically for all those people who are preparing for various entrances, be it MD, DM, MCH, or maybe if you're even in MBBS. I'd say make believe and make your wills and determination so strong that, you know, even your destiny is carved by your own will.
Correct.
God
Correct.
willing.
That's so nice to know about this, you know, your motivational quotes. It's so true, and it's rightly said that keeping yourself motivated, you know, in a positive direction helps you to achieve what you want to. Thank you so much for guiding us on such an important topic, something that is so relevant, something that everybody is looking for guidance and to be motivated on. Thank you so much for taking out time at this time for us.
Thank you, Dr. Ayushi. By our medium, I'd like to tell all the juniors, if you have any problem, you need any help, any assistance, I'm always there. I'll be more than happy to help them or motivate them or give them insights of whatever my journey have been, and give them a direction in whatever best possible manner I can. Thank you so much. And yeah, I'm glad you gave me that platform.
Yes, no, we are lucky to have you here. We are really grateful.
Thank you so much. Thank you so much.
Yes. Thank you so much, everyone, for being here at this time to discuss and to listen to such an interesting topic. I'm sure that you are motivated listening to this and has helped you to keep you motivated in your path of journey of your career growth. Do share this with your friends and colleagues. This will help them also to get an insight on how to pick up a branch and to get a better lifestyle for their career and to have a better life. Do follow us on our YouTube and Insta channels as well. There are some really interesting videos which will also help you with your career growth. Thank you so much, everyone. Thank you so much, Dr. Gaurav, for being here. Thank you.
Thank you, Dr. Ayushi.
Yeah. Bye-bye.